Good afternoon, everyone. I'm going to get started. It's 12:30. First of all, just hope you all enjoyed the bank holiday weekend. I'm Katie Jacobs from the CIPD, and I've been hosting our coronavirus series of webinars. And this afternoon, we're going to be discussing the emergent and highly timely and complex topic of what a return to the workplace could look like. Joining me to offer the advice that they can right now, a fantastic panel whose expertise spans HR and occupational health. We've got Rachel Suff, Senior Policy Advisor and Specialist in Employee Relations at the CIPD. We've got Nick Parle, CEO of the Society for Occupational Medicine. Simon Jones, Director of HR Consultancy, Ariadne Associates. And Andrew Willis, Head of Legal and Advisory at HR Inform, the CIPD's employment law resource, and he'll be on hand during the panel to provide answers to any tricky legal questions. Thank you very much, all of you, for joining us today. As ever, I'm just going to whiz through some housekeeping. Firstly, the session is being recorded. It will be available on demand via the webinar section of the CIPD website. That part of the website, you can also access recordings of all our previous webinars and sign up for future sessions. Secondly, if you want to submit questions during the webinar, and I'm sure you've got a lot of questions, please could I ask you to use the Q&A tab, which you should be able to see at the bottom of your screen. Please use the Q&A tab and not the chat function. We're not really going to be monitoring the chat function. We've had quite a lot of questions in advance, so we'll try and answer those as well. Thirdly, for legal advice, a reminder that CIPD members can call our HR Inform helpline. It's available 24/7 and you will get an individual response. And a reminder that we're updating the FAQs and resources on our website all the time as new information becomes available. Head to the CIPD Coronavirus Hub for more. And finally, I'm just going to flag our new Wellbeing Hub and helpline for members in the UK and Ireland. Together with award-winning workplace wellbeing provider Health Assured, we're now able to provide CIPD members with free help and support 24/7 and 365 days a year. You can access online and telephone consultations with qualified therapists. Members can access the phone number and the online services via the membership benefits webpage, and you'll see more details about it at the end of the session. So let's get on to the discussion. Attention is shifting to the next phase of the coronavirus crisis, with many organisations planning for recovery. While much remains unclear, it's becoming obvious that how we approach a return to the workplace appears to be more challenging even than the original lockdown. Now, we know from recently conducted CIPD research that many people are anxious about returning to the workplace, both about the office or site itself and about their commute. For people professionals, there's a seemingly endless list of things to work through, from the logistics of complying with social distancing and meeting stringent health and safety requirements to supporting employees with the psychological impact, whether that's managing anxiety about returning or managing the expectations of those who would like to return but can't. And of course, the workplace that people will be returning to, whenever that happens, will be radically different to what they remember. Our running order is as follows. First up, Rachel's going to set the context and give an overview of the government guidance as it is currently available. Then Nick is going to explain how employers can prepare for recovery from an occupational health standpoint. Then Simon will offer some practical guidance on what employers can and should be thinking about now from an HR perspective. And finally, we'll go on to questions, and Andrew from HR Inform will be on hand to take any legal queries. Now, this is a complex area and we are still waiting for the full government guidance to be published. So it's worth saying that we expect this to be the first of a few webinars on this topic, and we may not be able to answer all of the questions in the amount of detail that you'd like. We're waiting for guidance as much as you all are. But that's it from me for now. I'm going to hand over to Rachel to kick us off. Thanks, Rachel.
Thanks, Katie. Good afternoon, actually, everybody. So we have all now lived through 7 weeks of the lockdown in the UK. As people professionals, you'll have been under enormous pressure to translate stringent public health requirements into practice in your organisation because of COVID-19. That will have been challenging enough, but as Katie said, the next phase as we move into some kind of easing of the restrictions, the challenges there are going to be even greater. The next phase is being phrased as return to work, but I use that term cautiously. Many of us, of course, will have been continuing to work during lockdown, and we are still living with COVID-19 and the ongoing risk to our health. Nothing has changed in that respect. Next slide, please. So the government guidance that we are waiting for, which should be published the first part this afternoon, many will have heard the speech last night by the Prime Minister. Many will be confused from that speech, so we are still waiting for a lot of clarification. Also, the slight differences between England and the devolved administrations. But however confused people might feel this morning, it does not change the key principle that people can work from home, should be doing so in all cases where they can, and that people should only be going to a physical working environment anywhere if it's safe to do so. The Prime Minister last night mentioned construction and manufacturing. Actually, those industries hadn't specifically been ordered to close before anyway, although a lot of responsible businesses in that sector did close because they didn't feel that they could operate safely. As we wait for that further guidance to be issued, we will be doing our best to digest that, issuing further guidance to help you. But key points to note are that the easing of restrictions should be gradual. They will be conditional. They will still be led by those 5 tests, such as the so-called R rate being below 1, no increase in cases. So a point to bear in mind as we go forward is that how we respond as organisations will be constantly evolving in line with that guidance as it changes, because it could go backwards as well as forwards in terms of how restrictions are eased. It will be subject to constant change, probably, and a reinstatement of restrictions. Here, I've just got on this slide some of the key people issues to consider within that wider context. What should underpin any organisation's response to how it eases any restrictions? Health and safety, of course, first and foremost. People's health, safety and well-being as well is paramount. Whenever we've been surveying the profession, it's come back loud and clear to us that as HR professionals, you are putting people's health, safety and welfare first and foremost, and that has to continue. Any return as far as the CIPD is concerned, any return to a physical work environment should be necessary, it should be planned, it should be gradual, safe and mutually agreed. It's also dependent on those wider issues that also raised a bit of confusion last night. But obviously you can't take a decision to bring somebody back to the workplace unless they can get there safely. And also the schools and whether they're available, that isn't necessarily being aligned. So people who are still working from home or not even able to work from home, but they're looking after school-age children, that's another issue that has to be taken into account in that kind of holistic sense. As I said right at the beginning, the risk of infection to people from this pandemic is as real as it ever was. So COVID-19 is a hazard if you're exposed to it in the workplace, and it has to be managed as such. That means, and we hope to see more detail and clarity around this area of risk assessment and management in the workplace when we see the guidance. Every organisation will have to carry out a really detailed risk management process to safeguard people's health and minimise those risks. It will mean, as a starting point, implementing stringent physical distancing guidelines in the workplace, lots and lots of issues to consider as part of that. What will you do around the photocopier, communal areas, desks, and so on? So much detail to think about. And then as part of that process, really important to work very closely with your occupational health, health and safety, facilities management teams, and also where you have them, recognised trade unions, employee representatives, and other employee groups. So important at this time where risk can potentially be increased, that staff are communicated with, the conversation is two-way, and people are reassured. This is going to be the biggest employment relations challenge that you've ever faced. And if you think for the last 2 months, people have been told to stay home, to stay safe. Now that message in England, at least, is changing to stay alert. What does that mean? How do you manage and reassure people in the context of that change in messaging? What is your messaging and how clear and transparent is it? We know in terms of mental health that the risks from this pandemic are psychological as well as physical, and that is ongoing. And it isn't just during the crisis stage, as the World Health Organization has made clear, it's after the crisis as well. So it's really important that you have a framework in place to support people's mental well-being as well. And of course, we're all affected differently in terms of our psychological health, and it's not static, it will fluctuate. Most importantly, have you got that kind of culture at work where people can talk about their mental health and seek help if they need it? Then, of course, diversity inclusion is another really important area that needs to be taken into account. This pandemic has not had an equal impact on people in a whole myriad of different ways. Of course, there's equalities law and people being unequally impacted in terms of personal characteristics such as ethnicity, age, gender, health, disability. So a whole range there, factors to take into account. But it goes beyond that as well in terms of the kind of issues. Do you have care and responsibilities, for example? Have you been furloughed? Have you not been furloughed? So lots of factors to be taken into account there. Next slide. So this slide is a very sort of quick glance at a before and after environment in terms of what the workplace could look and feel like. So on the left-hand side, you've got two typical, nothing special images of a workplace. And what jumps out immediately before the pandemic is how close everybody is. And then on the right-hand side, you've got images that were actually taken from the draft government guidance that hasn't been published in terms of what you need to do in some of these workplace settings to implement social distancing at work. And you can immediately see you've got plexiglass screens, you've got the kitchen area sort of taped off, distancing, you've got chairs taped off, you can't sit there. So even what this quick glance of a workplace gets across is how different it's going to look and feel. The health and safety measures that you will need to take are onerous, but they're vital. But it also takes away from the workplace a lot of those factors that most people look forward to and enjoy, like social interaction, that sort of human interaction and so on. So it's going to be a very different picture. As Katie said, when we surveyed people on their attitudes about returning to a workplace, they were very mixed. Some felt anxious, others were quite keen to get back to work. But really, can people be expected to understand exactly what a return to a workplace will look like and what it will feel like as well? And so it's going to be a really big job for HR and employers to manage those expectations, especially if the reality doesn't meet the expectation as well in terms of what it looks like. Next slide. So underlining those three areas of people management focus that I talked about, such as health and safety and so on, are these 5 guiding principles that we have developed to support organisations and HR in how they navigate this really difficult road ahead. And it's going to require a lot of discretion, a lot of judgment on the part of employers. First of all, you need to know your business, because whatever the guidance looks like, it won't be highly prescriptive and detailed, and it will be left to your judgment and discretion. there is no one size fits all. You have to take your organisational context into account in terms of sector, size, and also the individual context as well. Put people first. People will need a lot of reassurance. They're returning to a very different environment. They will need to know it's safe. People's perception of what is risk and what is safe will have shifted quite a lot as well. So communication is really important. They need to know that they're going to be looked after and kept safe. Flexibility, I mean that in the broadest possible meaning, because home working, yes, that needs to continue wherever possible. That's a given. But also, how are you meeting people's individual circumstances in terms of flexibility? And flexible resourcing in terms of practices as well to promote social distancing are needed, like cohorting. So really small teams, keeping teams together so they don't mix, shift times. I think we'll see guidance around that. Staggering start and finishing times. It's going to be a really delicate balancing act, and managing the logistics are going to be really difficult. We've got guides in all of these areas. And then I've talked about the need for inclusion already. Line managers really need to be supported throughout this as well. And then, of course, be open, make sure it's a two-way conversation. People need to know that they can raise their concerns in a really supported environment and that they won't be judged for that. Next slide, please. Finally, we are introducing new guidance all the time on our hub page. And Katie's mentioned the employment law helpline, which is also a health and safety helpline. I want to emphasise that as well, because some of the decisions that you'll be making will be on a case-by-case basis, and they'll be complex and complicated. You'll be balancing individual need with fairness and consistency across the workforce. So really difficult calls on your judgment. So please do use our resources and those helplines as well. Thank you.
Thank you, Rachel. That was great. And just to pick up on, we've got a few questions about the content that we're producing and whether we're going to be producing various things. So just to flag up that we are obviously continuing to develop content around return to workplace all the time, but a lot of it, as Rachel said, depends on individual company and also personal individual circumstances. We are soon going to be releasing a record of returning to the workplace after lockdown conversation template to members, and we're planning on having further FAQs published by tomorrow morning. But just to flag that, like all of you, we're still waiting for the full government guidance. Now I'm just going to hand over to Nick, who's going to give us an occupational health perspective of all of this. Thanks, Nick.
Thanks very much. I hope you can hear me. So that was a brilliant presentation, Rachel, and I really commend CIPD and its membership. It's absolutely fantastic to work with CIPD, and their approach I really think is fantastic. And we're going to launch a toolkit on return to work with CIPD and also other partners like ACAS, Business in the Community, and Mind a week today, which will hopefully provide some detailed advice, particularly from an occupational health perspective. And I think if you don't know what occupational health is, it's really advises about the interaction between health and work and aims to protect staff from harm at work and maximise health and well-being. And the kind of people who are occupational health professionals are doctors, nurses, hygienists, physiotherapists, psychologists, a huge range of professionals who can help with different aspects. And as a Society of Occupational Medicine, we reflect that multidisciplinary membership. So occupational health assessment advice that helps with this return to work, working with HR managers on issues like testing, isolation or illness, and also provides evidence-based advice and management of mental and physical health issues. And I think one of the challenges often is people do spin off in non-evidence-based directions, and certainly we follow a kind of evidence-based approach of what works and what doesn't, as much as I totally agree with what Rachel said in terms of different workplaces have different challenges, but there are evidence for different workplaces that we can bring to the fore, but particularly in terms of, say, mental health, which is an area where occupational health professionals don't want to medicalise necessarily. it's complicated, and an evidence-based approach is really important to ensure people stay at work where it's right to do so, not medicalise. I think occupational health can also help with temporary and returning staff, and as I said, really support HR and the employer in interpreting evolving guidance, which, as we know, is very much evolving. Next slide. So in terms of where we are now, I mean, clearly a lot of workplaces have continued, be it in retail, telecommunications, transport, emergency services, and we've been advising on that in terms of guidance and putting that into place. And we produce blogs on topics like working from home and technology and COVID, but I'm sure the CIPD one's a lot better, and stay with that, but do have a look if you want. Next slide. So in terms of the data to guide the decisions, I mean, Boris Johnson yesterday talked about the R value, flattening the curve, and if it rises, need to increase social distancing and protection measures once more. So hopefully, you understand that. I think a big challenge is testing, though. I mean, we haven't got an antibody test. We're expecting one. I think one has been found that will work, but it's very difficult to sort of progress and move back to normality in any shape or form without an effective test. And as it stands now, we've got a test that's only a snapshot in time, but obviously it can guide who has infection and who hasn't, and are now immune, although there's clearly kind of, that's not absolutely certain about that level of immunity. We do think it's important to share these results with occupational health. It's not required legally, but I think the toolkit talks about what to do if you have had a test that's positive. And also there's good data in terms of coming decisions, such as absence data, in terms of people who've experienced or currently experiencing COVID-19. And there's been some data in healthcare settings where the COVID rate has been very high. Clearly healthcare is a particular risk rate, but that will guide decision making. But the frank truth of it, unfortunately, is that reopening workplaces is likely to put staff members at risk of encountering the COVID infection. So occupational health is advised, and to protect particularly the most vulnerable members of the workforce. And as Rachel said, there are particular vulnerabilities for Black and ethnic, minority ethnic groups, to people who are, have particular underlying conditions. And I suppose what occupational health does is assisting with that individual risk assessment that the manager will carry out, and also linking that with the organisational risk assessment to take a view. And there's some quite detailed risk assessment tables that we think will be signed off by the Royal College of Physicians and hopefully used as the main basis of which risk can be assessed. And I'd like to see what the government guidance is at 2 o'clock, wherever it's going to be launched, and whether they have that detail there. Certainly we feel we're ahead of the curve in terms of analysing risk. Next slide. So in terms of kind of return to work, general issues, just to repeat, working environment is going to change, may not return to normality for any time soon. And it is the role of leaders and managers to set those expectations and company-wide goals. And this presentation is titled Building Back Better, which is, there's an opportunity to have workplaces that, for example, take mental and physical health issues as important as each other. And there's an opportunity to really show good management and leadership. And that is for good, healthy workers and productivity. We know that there's an evidence-based and return on investment, that if a good, healthy workforce that is supported and they have a level of control, then you get better results. I think the key word, and just the one takeaway from my presentation, as much as hopefully understanding what occupational health can offer, is risk assessment. And the government, I think, will definitely say there needs to be a risk assessment. I think they're saying for over 5 employees, and that may be for people with particular health issues. And different personality types may need additional support. Some people may not want to go back to work, and there's clearly kind of legal issues there in terms of what happens then. There are particular mental and physical health issues. A lot of people may have suffered bereavement, and obviously there's bereavement support needs to be put in place. Readjustment following redeployment, returning following furlough. And some people just will want to leave the business and do something else. Next slide. So in terms of vulnerable staff, I mean, the government's obviously got this current two groups of people, those on medical grounds as extremely vulnerable, and those at increased risk, 70 or older. I mean, frankly, that was produced slightly kind of finger in the air on what the risk is. For example, I heard from a member who's working at ITU in UCLH that people with HIV and people who've had transplants have actually done well with COVID, because actually with the response from the immune system, they don't get that sort of shock, and actually the sort of outcomes are good. So that's just an individual example, which perhaps not very evidence-based, but I think as evidence emerges on what COVID, how people react to COVID according to different conditions, that guidance hopefully will be refined. So as I said, managers need to agree with occupational health advice, ideally the most appropriate and practical process for identifying such vulnerable staff and completing a risk assessment. And it really has to be in discussion with employees. And it's interesting working on this toolkit with ACAS, how much they emphasize that need for partnership and working together as a way of really dealing with obviously an incredibly challenging and difficult issue. Next slide. So there's all kinds of advice out there in terms of the return to work, the planning and the physical environment, and I'm sure you're thinking of this already in terms of hand washing, respiratory etiquette, physical distancing, teleworking, staggered shifts. I think it's all going to be part of the solution. Team A, Team B, coming in different weeks, for example, or different times, and practice really to reduce crowding, and the hygienists can obviously help with that in terms of, for example, airborne transmission in particular situations. Again, to re-emphasise, return to work conversation has to occur, and that needs to start happening now. We mustn't sort of put our heads in the sand. Really, planning now is important so people are ready for when they come in, that the first day will be secure and assured, and know what to expect. People obviously, some people are very nervous. So I'm sure you're thinking about things like the use of elevators, and who can use those elevators if at all, and how many people are going to be in there, how to work in teams. The implications, as Rachel said, about distancing, and it's going to be difficult, for new starters in the business, or people who require a lot of new ideas to be created. How you create those spaces for that to happen. Desk spacing, office protocols. Really important that people feel that sense of security and control of what they're doing, and supported to come back to work. And I think it's just important to re-emphasize communication. Next slide. So mental health. I've talked about the connection between well-being and productivity and competitiveness, and I think we should really recognise mental health is important, physical health, and this is you can see what people are feeling in terms of surveys in this, and we need to support those managers to support people's mental well-being, prevent that stress with kind of effective communication, and to think about the job design, whether they're the right jobs. Things are really it's an opportunity to readjust and change jobs so they're good jobs that support people and allow them that control to carry out their work. People are going to have depleted mental health. Maybe they're not though. Maybe they've actually quite enjoyed and had a period of growth. They've done things that they have enjoyed over this time. So it's not necessarily, I think the catastrophization isn't a good way forward. I think a focus on mental health and supporting that is important, but it's not necessarily going to happen. And some people can actually see it as a time for growth. But it is as we come out of the other side, this is the kind of crucial time to make the difference. And things like PTSD and trauma, this is the time where you can avoid that if effectively managed. I think as well as working with HR, occupational health, links with kind of particular providers, be it on cognitive behavioral therapy, counselling, there's employee assistance programs. Often those counselling services aren't taken up, and now's the time to do that. And there's also, as Rachel said, I mean, home working, as Boris Johnson obviously said, home working should continue, but there are risks there too, and you need to bear in mind that it's not always easy just being isolated. There's a trauma of the situation, but also the opportunity for lessons to be learned, and we can really build back better, I think, as this presentation is entitled. So I think just in summary, I think it's that let's focus on risk assessment, individual and organisational. Let's focus on incentive and supportive discussions. Take advice from occupational health where it's there's special situations, and encourage staff to look after themselves and see it not necessarily as I said, a catastrophization, but think about their own self-care, continue what they've been doing that's been good for them, be it good diet, sleep, relaxation, and support counselling if necessary. Thanks very much. Great to be part of this, and we're looking forward to the guidance, and do look out for the toolkit, which will no doubt be circulated through CIPD. Thanks very much.
Nick, before you go on mute again, a few questions about when we can expect to see the toolkit.
Yeah, it's going to be launched next Monday. We've got a draft version. We're not precious about this. I'm happy to send it through now so people can see it now if you want. But it will be formally launched on Monday. But the basic principles are going to be the same, probably referencing the government guidance. So I'm happy for it to be shared in its draft format now if necessary.
Thank you. Thanks very much, Nick. Before we get on to questions, just got time for Simon to give his 10-minute insight into the kind of HR considerations of all of this. Over to you, Simon.
Thanks, Katie. Good afternoon, everybody. As Katie may have outlined, and you can see from the slide, I'm director of Ariadne Associates, which is an HR consultancy, and we work primarily with small and medium-sized businesses and charities, but hopefully a lot of the points that I'm going to make will apply to the majority of organisations. And before I start, I'd just also like to say thanks to Rachel and Nick. I've learned quite a few things today, and I'm certainly probably going to pick up on some of the points they've made in their presentations. I think the first thing to say is this is a completely new situation for almost every one of us. I've probably said I don't know more often to questions from clients in the last few weeks than I have probably in the last 10 to 15 years. And it is something that we're all learning as we go along with this, and there are no right or wrong answers, I think is the issue at the moment. I think we're starting to see some slightly different approaches and advice as well in each of the 4 UK nations. So you need to think about where you're based and where your company works and be following the guidance from that particular government. So if you're in Scotland, follow what the Scottish government is saying, because there is a slight divergence now. But as I said, there's no right or wrong answers at the moment, and we probably need to go back to first principles. And I was actually, as I was writing this, I was thinking that the CIPD professional values are a really good place to start. Rachel's outlined some of the more detailed ones, but I think the fundamental ones of being principles-led, outcomes-driven and evidence-based are the 3 that we need to focus on. Now, the problem is at the moment, we don't really have any evidence other than perhaps some of the international examples where countries have eased lockdown maybe 2 or 3 weeks ago. And even there, it's probably too early to tell. So there isn't a best practice solution that we can rely on, and we can't benchmark against what other organisations have done. So we're really going to have to rely on the first 2 points. What outcome do we want to achieve, and how do we do that in an ethical way? And how you do that's going to depend very much on your organisational issues, as both Rachel and Nick have said. You'll need to think about issues like the culture, the sector you're in. But I am, I hope, going to give you a few key pointers. And again, as everybody else has said, the one thing that's very clear is that there won't be an immediate return to work as it was in February. It'll be a gradual process. It's going to take some time. And also you need to think about what's right for your business. Just because the Prime Minister's announced that we can all go back to work from Wednesday or Monday, depending on which version you're reading, you need to work to the timescale that suits your own business. So don't feel that you have to recall people this week if it's not the right thing to do. I think one of the first key things to do, though, and quite a few of my clients are doing this, is to set up a project team. It's a very simple, practical way of doing it. There are lots of issues. We've talked about the HR issues, we've talked about the occupational health issues. There will be estates and facilities issues that you need to do, and business operational issues. You need to get people together within the team, and HR has got to be a key part of that team, if not actually leading it. Now, initially that team might be virtual, but if you're talking about reopening premises that are shut, then you might actually want to meet up physically, obviously suitably socially distanced, but you want to be able to assess some of the problems and some of the issues that you're going to face within your own particular workplace. And that, again, that's going to vary very much from organisation to organisation. Now, one of the key things, and it's been touched on briefly by the other speakers, is to think about some of the issues that you're going to have to tackle immediately. And those of you who've done your CIPD or another HR qualification may well remember Hertzberg and his hygiene factors and motivation factors. Well, what I'm going to talk about to begin with is very much, in fact, quite literally the hygiene factors, the sort of things that you need to think about. It's certainly not the most glamorous or exciting part of HR, but it is something that we'll need to deal with. So the first thing to say is if you are going to be reopening premises that have been shut for any period of time, you'll need to make sure that there's been a deep clean of the offices or the workplace. So again, that will involve liaison with the cleaning contractors, cleaners, and so on. You'll need to make sure that there are things like adequate supplies of soap in the toilets. It used to be that finding a soap dispenser empty when you want to wash your hands was a minor inconvenience, I suppose. But now it'll be a serious health and safety issue. And I think the message about hand washing has kind of taken a back seat recently as we've moved into other messages, but it's still the most effective way of eliminating the virus. So 20 seconds of washing your hands while singing God Save the Queen, Happy Birthday, or my personal favourite, which is Jolene by Dolly Parton. But you know, it's something that you need to be reinforcing that message that people should be able to wash their hands when they come into work, be doing it regularly throughout the day. And again, just simple things like making sure you've got plenty of soap in stock is important. And you also need to think about other supplies that you'll have to provide. So, for example, you might want to make sure you've got antiviral hand gel, and we know that there was an issue with that a few weeks back in terms of supply. So can you actually get hold of it? Will you want to provide wipes for phones, screens, or other equipment? And will you be providing personal protective equipment? I'll talk about face masks separately in a minute or so, but first of all, again, you'll need to think about, can you get hold of it? There's issues about, you know, if you're ordering PPE, are you depriving places like care homes or the NHS? But also there's the cost of it. We saw Rachel's graphic of the plexiglass screens between workstations. Now, that may or may not be a viable option for you. It's not necessarily a cheap option. You may want to look at other solutions rather than going down that road. And as Rachel also mentioned, even though there's been a lot of talk about the end of hot desking, there are plenty of other shared work facilities that you'll need to think about. And for example, printers, copiers, etc., tea and coffee areas, even if you don't have a canteen or kitchen. And you'll also need to think about shift workers. There's been, again, talk about using cohorts and teams and staggering shifts and staggering workers. But if you're going to have people working in the same work area, are you going to be able to do an adequate clean? A really simple example, if you have an early shift and a late shift, is there going to be time between the two shifts for a clean down of the workstations, the work areas? We've heard a lot of talk about manufacturing being one of the early areas to go back, and manufacturing is obviously something that can't be done, generally speaking, from home. But you will need to think about, can you clean down the workstations, the work areas between shifts? And if you can't, then you'll need to think about, is there another way in which we can do this? So a lot of very practical things. I mentioned before about face masks and gloves, and that's quite a controversial area because, again, the medical evidence is kind of mixed about those areas. And so you need to think about, are you going to provide them? And if you are, you need to train people on how to use them correctly. So if you do have an occupational health provider, they'll be able to give you advice. The manufacturer should also be able to give you advice on correct usage. And there is also plenty of useful information on the Health and Safety Executive website about that. And as I say, you need to make an assessment about whether that's an appropriate thing to do. We've got no steer so far from the government other than possibly it might be helpful in certain situations, but you need to think about that. And we've talked repeatedly about the issue of social distancing in the workplace, and again, that's going to have to be something that you plan out. It's going to be very much dependent on your own individual workplace or office environment. So have a think about how you can do that. And it may not be possible in every single situation. Now, currently the government guidance does actually give you some useful tips on what to do if you can't maintain social distancing at all times. For example, it suggests that you have workstations where people are sat side by side rather than facing each other, so there's less chance of the virus being passed. But obviously that's not an ideal solution. There will still people who will be concerned about that. So again, think about that, but use the government guidance. And I say, even though we're waiting for the latest version of the government guidance, the existing one that's there, which I've been busy refreshing all morning to see if it updated, but the existing one that's there is certainly helpful in that situation. But you also need to think about meeting rooms. There's a balance between holding a meeting and confidentiality. It's quite difficult to hold a disciplinary hearing or a recruitment interview while still maintaining a 2-meter distance between people. You might not physically have rooms large enough to be able to do that. So again, you need to think about how you're going to manage those situations. So that's the first area really about, it's very much the practical hygiene side of things, but obviously there are a lot of other areas that you need to be thinking about, and your project team should probably be managing. So as we mentioned repeatedly, good communication with employees, and you need to think about the best way of doing that. So it's not just about you sending out messages as an organisation, it's about listening to people and understanding their individual concerns. And I'd suggest that it's probably better, if you can't do it face to face, which probably you can't, is to use things like email, phone and video, rather than relying, as some organisations have tended to do in the past, on things like text or announcements on an intranet or so on. And again, just to reiterate, if you do have trade unions in your organisation, you should be talking to them about the best way forward. They'll on the whole be quite constructive. Certainly with my clients where they have unions, the unions have taken a very constructive role in dealing with their situations. Again, to reiterate, bringing people back gradually, keeping people working from home where they can do is important. And actually, one of the things that the last few weeks has probably made a lot of people realise is that there are more jobs than maybe you thought that can be done from home. And it may not be the ideal situation, but they can still be done. Again, the idea of staggering start and finish times or having certain people in at certain times, you need to think about, is that practical for your business? Can your business still operate on that basis? It may work, it may not. One of the things that was mentioned last night by the Prime Minister is avoiding public transport. Now, depending on the type of business you are, the type of location that you're based in, that might not be a possible option, but you will need to think about how can people get to work without public transport. And one of the things that I think is a very useful tip is if you already have a bad weather or snow policy or travel disruption policy, so maybe look at that. It may not fit perfectly, but that's a good starting point for developing any policy that you might want to do with now on public transport. You'll also need to think about people travelling on business. A lot of organisations are not going to want sales reps popping up from your company to try and sell their products because simply of the social distancing, or the right people may not be in. So what are you going to do with the sales force and so on? And the final point I think that I wanted two final points. One is that how are you going to manage if somebody breaks the rules? What if somebody keeps deliberately breaking or ignoring social distancing? Is that going to become a disciplinary matter? How are you going to deal with those situations? We've talked a lot about other situations, but you might need to think about that. If somebody might do it inadvertently, but then again, it might be repeated behaviour. And the final point I just wanted to make is just in relation to possible redundancies. There are all sorts of rumours going around about the furlough scheme. All we know for definite at the moment is it runs till the 30th of June. Redundancy is an area where we all do currently have good, clear advice about what the law says and the procedure we're supposed to follow. But as a very practical thing, if you're thinking that you might need to make more than 100 people redundant, you'll need to start collective consultation this Friday. And if it's more than 20 but less than 100, you'll need to make sure you started by the 29th of May. So you don't have much time to plan out if you're relying on the furlough scheme to keep things going. So, as I say, just to kind of end, I think just want to reiterate the points that that both Rachel and Nick have made. It's very much about dealing with situations on the basis of your own individual business, what's right for your business, what's right for your employees, and what is the best thing to do. And as I say, going back to the CIPD principles is probably a good place to start thinking about some of these things. Thanks.
Thank you very much, Simon. If I could ask all the panelists to unmute themselves, and we'll take questions. I've got quite a few questions. Won't be able to answer them all, sorry, but I'll try and group them and ask the ones that we've had multiple times. I'll put this first of all to get a legal perspective from you, Andrew. What are the options about employees that are reluctant to return to work because they're worried about their family members? We've had a few questions about this. Some people reference having shielding letters, and some people say they don't have shielding letters, but they're still saying they're worried about vulnerable relatives in their households.
Yeah, I mean, I think one of the things Simon touched on there was don't rush into bringing people back into the workplace. And I think that's right. I think now is the time to be having individual conversations with employees and asking about their circumstances. I think as we've talked about before on these webinars, I think what might have been a reasonable adjustment in the past, you know, the category of intervention that might be reasonable in the future will be a lot more than in the past, because we've conducted a huge working at home experiment in the last few weeks, and in many cases it's worked reasonably well. So I think it is incumbent on employers to explore alternatives for those employees affected by their own circumstances or by the circumstances of family members. The acid test and unfair dismissal is, did the employer act fairly and reasonably? One of the main issues in disability discrimination cases is, were reasonable adjustments considered and implemented? And I think working at home, working in a staggered way, all of these things would need to be considered. Ultimately, if you need people back in the office, and if the furlough scheme's at an end and that's no longer an option, then really you can insist on people coming back, and the consequence if they don't, certainly first off, is that they won't be paid, and that may solve the issue in lots of cases. But I think before you get to that stage, you must have considered all the alternatives available, and you know, considered them in a way you may not have in the past. So shift working, staggered working, home working, all of those things should be on the table.
Thank you. Rachel, Simon, do you have any kind of HR advice on that one?
Well, just to add, I mean, it is, I think a lot of employers are going to face a lot of situations like this. And just to add to what Andrew said, I mean, sometimes there might not be a perfect solution, but it's just having patience and trying to explore with that individual every possible solution. It might end up with somebody not being able to be paid. But I think we have to bear in mind as well that some people, you know, the anxiety that they feel, they might need a reasonable adjustment for that. So just do whatever you can, really, in every situation. We know it's a really delicate, hard balancing act.
Thank you. Nick, have you got any thoughts on, got some questions on testing, whether there are any guidelines around whether employers can ask somebody if they've been tested, and if and when there's an antibody test available, can an employer request that their staff take it and then tell them the results?
I don't think I could comment on that with any assurity in terms of the kind of the legal position on that. I think you probably need to take legal advice in terms of sharing that kind of information. I mean, clearly it's in everyone's interest that there is information that's passed to the employer and occupational to make informed decisions, but and permission obviously is necessary for that. So I couldn't comment any further than that. I did see there was questions actually just kind of moving on to thermal imaging, which temperature checks, which there's poor evidence base and might not be practical in certain in many places. So that should be sort of advised with caution as well, temperature checks. But in terms of testing, I mean, actually the current position in terms of sharing results with occupational health is it's not allowed under data protection, which I think is a shame because it will allow everyone to make an informed decision. So currently data sharing isn't what we would prefer.
Thank you. And so is that the thermal imaging isn't really evidence-based?
Well, it's mixed and not exactly recommended. Certainly we haven't recommended it.
Thank you. Simon, how does it work if, as an employer, you're pretty convinced you've made the workplace as safe as possible, but your staff don't agree with you?
Well, I think you'd need to understand why staff felt that they were that you hadn't done enough, or that you hadn't made things safe. I mean, that comes back to the communication issue. What are their concerns? Why is it that people think, you know, if you've done a lot of things and you're following the government guidance and you've done proper risk assessments and so on, you need to understand what is it that they've got concerns about. Now, there will be some people who I think are just generally very nervous about coming back into the workplace and you know, have kind of got into, they may not like, but they've got into the situation of not mixing with other people, and they're just very concerned about that. But I think you need to understand what those concerns are rather than just relying on it. But ultimately, if you think you've done the right things and you've got the evidence to back it up, then you can, I won't say insist, well, you could insist, I guess, in certain situations. And I think, again, that's something that probably Andrew would want to pick up on, about your right to be able to do that if you think you've done everything reasonable in the circumstances.
Yeah, I mean, I think in a large enough workforce, you're going to have a range of people, some of whom are very, very anxious about coming back to the workplace, others who may be fairly blasé about observing what you put in place in an attempt to protect everybody. So I think that early communication with people is important, preferably before they return to work, to explain what you're doing and why, amongst other things, as well as talk to them about their individual circumstances, explain what they're coming back to. You want real clarity about what people are expected to do to maintain safety for everybody. And then you want to be consistent in the way you deal with any departure from that. And in some cases, it'll be a matter of dealing with grievances and complaints from people who are very anxious and don't think things are going far enough. And in other cases, it may be a question of disciplinary action from people who repeatedly ignore what's been put in place. But certainly as an employment lawyer, when I'm defending a claim, what you want to see is clarity from the outset. You want to be able to demonstrate that everybody understood what they were being asked to do and why. So I agree with Simon, that's the first step, really, to be really clear about what you're doing and why you're doing it, and then you can address other issues around that.
Thank you. We've got a few questions around BAME employees who might be more vulnerable and therefore perhaps not able or willing to come into work. Do you think there is enough evidence for dealing with this differently at this point? Can you offer any advice on this topic? I know it's still quite emergent. Putting you on the spot.
Certainly, as an employment lawyer, I'd be very, very nervous about collecting that kind of data and categorising people in that way. I think it would be better for employers to follow the guidance as it is. So guidance around self-isolating and shielding, which as far as I know is still the guidance that's in place. So you self-isolate if you've been in contact with somebody who has symptoms. You self-isolate for 14 days. If you have conditions, one of the long list of conditions, then obviously you would probably leave those people home working longer than other people potentially. And of course, there are still the more vulnerable people who, as far as I know, are still partway through that 12-week isolation period. And I would prefer employers to be having conversations around those vulnerabilities rather than basing any decisions on racial or ethnic background.
Thank you. Nick, can you advise on the occupational health implications for staff that are going to continue to work from home? Because given this people might have assumed this was a temporary situation, but if we're all going to be working, or if a lot of us can be working from home for the long term, obviously all the equipment you need is quite costly for employers.
Yes, I mean, first of all, I think following on what people said, I think it's really important there's a kind of audit trail and things are clear in terms of what's been discussed when, in terms of kind of, you know, legal issues that obviously might come up later. And it's really important there is a risk assessment both for home workers and people in the workplaces I've talked about, and kind of the risk assessment approach is on that template which I've sent through to you to circulate. I mean, in terms of workplace kind of risk assessments at home, the HSE have advice on that in terms of ergonomics and the need to ensure there's a kind of risk assessment in terms of your workstation, etc. So it's good advice from HSE, and I can see also on the Q&A some thoughts about what the HSE's role might be. I mean, I suppose we have regular calls with the HSE about kind of issues, and I think they are taking quite a reactive rather than proactive approach to this. Certainly there's reporting should happen when there's been a kind of near miss or an issue, a RIDDOR reporting, and that's kind of an occupational health issue too, and we'd like them to be more proactive in terms of, for example, following up about healthcare worker deaths and issues in the healthcare system. So just to comment on that, but certainly just in terms of home working, there needs to be that ergonomic assessment and risk assessment generally. So I'd prefer to the HSE on that.
Thank you. Got a question about if we're going to have more people home working, how well do you think the HR profession is prepared to manage a dispersed workforce and help managers do the same? Simon, any thoughts?
I think we're probably better than we think we are. I mean, there are obviously issues, and Nick's just alluded to things like doing risk assessments from home workers, but we already, in a lot of cases, manage people across different sites, different locations. We have staff who are, as I mentioned before, salespeople, for example, who are out on the road. People who are doing welfare visits or out visiting clients or whatever. So we are actually quite used to managing people in diverse locations. It's obviously a bit more problematic in the sense that you'll have lots of people in lots more different places, but so long as you've got the communication links and you don't forget about home workers, again, if you've got a majority of people or a significant number, you won't do that, but so long as you make sure that home workers are included in general communications and so on, I think we're probably better placed than we maybe sometimes think they are.
Rachel, do you have any advice on how to deal with repeated failure to do social distancing, other safeguarding or hygiene policies? I know this is something that Simon mentioned earlier. We've had a few questions on how you actually go about enforcing it.
Well, I think organisations and HR have to put across very clear and strong guidance on it. And let's not forget that actually employees and workers have got responsibilities as well, not just employers, for health and safety. So maybe the workforce need reminding of that. So it's incumbent on every individual in a workplace to implement those social distancing and basic hygiene, respiratory measures as well to keep everybody safe. If it persists, then there has to be a conversation, quite a firm conversation with that individual. But I think we can trust most of us to actually comply with that. So I wouldn't worry too much about lots of flagrant abuse of those health and safety measures. You know, for 2 months, everybody's been living with this messaging now. So I think most people will be very aware of what they need to do. If that needs reinforcing, that needs strong reinforcing though.
Thank you. I'm just going to, one very quick, well, probably it's not a quick answer, but I'll ask it quickly to Andrew. What are the legal implications with risk and duty of care? Final question, sorry, that's quite a big question.
Well, at the moment, it comes back to the Health and Safety at Work Act and the responsibilities of the employer under that act, and employers as well, to echo what Rachel just said. Certainly there are business groups lobbying for some clarity around liability and whether, to a degree, employers and organisations could be excused liability. But for the moment, the law has not changed. So you have a duty as an employer to maintain a safe working environment for your employees. and that's the test you'll be measured against.
Thank you. I'm going to have to bring it to a close there. I'm sorry, that's all we've got time for today. Thank you so much to the panel. Thank you everyone for putting in your questions. I'm sorry we didn't get to answer all of them this time. The webinar and the slides will be available on demand from this afternoon, so feel free to share them with your peers and colleagues. A reminder that you can sign up to future webinars via the CIPD website, and we will be exploring this topic in the weeks to come. We ended up doing 3 or 4 webinars on furlough, so I think return to work is the new furlough, so there'll be plenty more to come, so we will hopefully be able to pick up a lot more of your questions. And a final reminder about our new wellbeing support for members in the UK and Ireland. You can see a slide about that now. We're able to offer a free 24/7 telephone helpline staffed by qualified therapists and provided by Health Assured. That's all we've got time for now, so thank you very much for watching and goodbye.